everyone. I'm Anya Parampil, and you're watching Red Lines. As coronavirus sweeps the globe, even wealthy, former imperial powers are struggling to care for their ailing populations. But for colonized nations, that problem is compounded by centuries of exploitation and forced underdevelopment, leaving them completely unprepared for the outbreak of coronavirus. One such nation is Haiti. As a recent article at the Grayzone points out, quote, while Haiti's widely despised U.S.-backed government officially promotes social distancing to suppress COVID-19, the stark reality is that most of the population is likely heading toward herd immunity, where many must get infected in the street rather than die by hunger at home. One of the article's co-authors, Dr. Jeb Sprague, a research associate at the University of California, Riverside, joined me earlier to discuss the situation. Welcome to Red Lines, Dr. Jeb Sprague. You're joining me from The Hague. So I appreciate you making the time this evening to speak with me and talk about your latest article in the Grayzone. In a lot of countries, the weaknesses of the healthcare systems, even in wealthy countries, have been laid bare by this crisis. And Haiti is a country which was already struggling. So, Jeb, what is the current status of the coronavirus situation in Haiti? What are the official numbers and what has been the government response?
So thanks for having me, Anya. Right now, we're facing a disaster of epic proportions. And it's going to, no matter what I say, it's going to sound alarmist, but it's almost unbelievable, the information, everything that we've been finding out about Haiti and a lot of other countries where this is starting to spread. The other day on Radio Quisquia, one of the better known, one of the more respected radio stations in Haiti, experts were being interviewed talking about possibly 800,000 Haitians that could die through COVID-19. And for that article, we interviewed a doctor at Haiti's the State University hospital there in Port-au-Prince named Dr. Ernst Noel. And he said it's not an overestimate. It might only be hundreds of thousands, but it could reach this insane level of deaths in the country. And the reason is because the country has basically been gutted over the decades of its public infrastructure. Right now, Haiti spends about $13 per capita annually on its population for healthcare. That's compared to the Dominican Republic that spends about $180, and Cuba about $781. And right, their healthcare is organized in different ways. And so Haiti, there's a lot of NGO and private-run healthcare, like Partners in Health in the center of the country has a very solid hospital, but they can only handle so much people. And so just today, HUEH, the State University of Haiti, the doctors and nurses they didn't show up to work. They're afraid that they will all get COVID and numbers of them will die because they don't have the protective equipment that they have. In the entire country, this is the whole country of around 11.3 million people. Of that entire country, get this, 64 ventilators. 64 ventilators. So what's the population of New York? Like 9 million or so? There's thousands, I think more than 10,000 ventilators in New York. I'm not sure the exact number. But in Haiti, it's 64 ventilators, and some of those don't even work. There's an estimated between 30 and around 120 functioning ICU beds in the country. So it's very, people are very worried in the country. And because people live so much in the informal economy with about a 40% unemployment, and it's a daily struggle. Mm-hmm. People, through their economic activities, are involved in informal, small-scale economy. They can't barricade themselves in their room. They can't hide away for months on end. They have to go outside.
Yeah.
And yeah.
That's getting into what I wanted to ask next, which is how does the economic picture make it very difficult to combat coronavirus. I know something you mentioned in your article is that the dependence on neighboring Dominican Republic has had an impact here as well.
So there's a large part of the population that is dependent in Haiti on remittances. There's a lot of Haitians that have migrated that come back and forth across the border, that work in agriculture, that live in the big cities, that live in the border regions. And so the virus is the pandemic, the coronavirus, it's hit Dominican Republic earlier because, as we know, a lot of this has really spread rapidly through people traveling through the mass airline travel that we have in our globalized economy. And so the Dominican Republic has a lot of tourism, a lot of people coming in and out internationally. So right now in the Dominican Republic, there's I wrote this down, there's 1,100 cases of COVID-19 with 51 dead. In Haiti, there's only 15. But the Dominican Republic has a much more solid healthcare infrastructure. Just last night, the Dominican government arrested around 19,000 people for breaking curfew. Wow. So they've been trying to enforce a curfew, but they haven't. They've had a lot of trouble. They ramped all this up very slowly, and so there's a lot of fear in the Dominican Republic right now. I talked to a friend in Santiago, the second biggest city in the Dominican Republic, and he said that the hospitals there are actually not accepting more patients. They're already filled to the max, right? And they're just starting their climb up the, what is that called? The curve. The curve. They're just starting their climb up the curve. So this is very worrisome, as the United States and Europe and so many developed parts of the world are really focused internally. The difficult thing is then how will aid get to these other places that have been so underdeveloped, right, historically through colonialism and imperialism.
Are Haitians able to find tests, as far as you know, and connect what's happening now, the country's underpreparedness to respond to coronavirus, the crumbling healthcare system, which you described, to the demonstrations, the protest movement we saw emerge last year against U.S.-backed President Jovenel Moïse?
Okay, yeah, Jovenel Moïse. Yeah, so from what I could find digging there, there was only I think about 50 or 60 tests that had been done about a week ago. I think they've done a few more, but they don't have the infrastructure. There's been in Haiti, there's been an association of entrepreneurs from China. There's a lot of these textile factories, these sweatshops in Haiti. There's people from different parts of the world that have sweatshops there or work with local subcontractors. And so there is a shipment, I guess, coming in from China of a lot of test kits and equipment, but that will take more time, some days to arrive. There's been about 350 Cuban doctors and medical specialists that arrived in the country a few days ago. Haiti in total has about 900 doctors. That's again for a population of 11.3 million. And so it's going to be people are going to have a lot of courage if they're going to fight this.
And so Cuba essentially increased the number of doctors in Haiti by 30%.
Yeah. Cuba's had doctors in Haiti since 1998. Really under the Lavalas governments of the first Proval government and Aristide's first and his second government, both cut short by coup d'etats. They improved relations with Cuba. And so the other part of your question on how do we then connect this with the political situation? So as your listeners will know, Haiti has been devastated, not just by natural disasters like by the earthquake and the hurricane, which was amplified by climate change and hurricanes, but also by man-made disasters like the 1991 coup d'etat and the 2004 coup d'etat, and then the way in which the response to the 2010 earthquake. These have all really, Naomi Klein's shock doctrine. These were really put into effect after these rapid political transitions, and where they really tried to economically and politically remake the country into a stable platform for like transnational companies and transnational capital. And so what we've seen then over the last decades is really the evisceration of the public safety nets in the country, heightened repression, and really people existing on a shoestring budget. Things like the massive increase in remittances of Haitians with family members abroad, that's been a real key lifeline in people's survival. So, as we've had this globalized economy, there are also all these problems wrapped up in it, and how the U.S. intervenes in different regions like the Caribbean. And Haiti has really been like a laboratory for U.S. intervention, and now really trying to barricade them off they don't want people fleeing the country and having problems like they did in the 90s when people started taking small rafts right to South Florida.
And what about the scandal surrounding Petrocaribe, that program established by Venezuela to help impoverished nations in the Caribbean develop?
So in addition to this new Latin American ALBA left alliance that has existed with Venezuela and Cuba and other countries like Nicaragua and Bolivia, formerly under Morales, where these countries are still in a capitalist economy, they're still engaged in capitalism, but they still in part are engaging in this alternative developmental path where they're trying to, create different South-South organizations and institutions. And so Petrocaribe was like an offshoot of that, and especially driven by Venezuela when they had, when oil was at a higher value, and when they, before the intensive hybrid war now that the U.S. is carrying out, when Venezuela had more capabilities, Petrocaribe was really active across the region in a lot of countries, not just progressive or left-leaning countries, but they were helping countries across the region, like Jamaica and the Dominican Republic. And so a lot of countries built up infrastructure, plugged budget shortfalls, and the money helped a lot. But in some of the countries, and in Haiti in particular, there were governing officials that really use this through corruption, or use, with different corrupt maneuvers, like Michel Martelly, the former president, and now Jovenel Moïse, who through different, basically through a investigation in Haiti's parliament, we know that like many millions of dollars were stolen, possibly hundreds of millions of dollars, and Jovenel Moïse is named like 69 times in this recent case, and so he was definitely involved. And so there's a lot of the protests. There's a lot of there's a major crisis of legitimacy in the country, because when Moïse came to office in 2016, the election, there was only an 18% turnout. So, and Martelly before him, in the wake of the earthquake, also had a turnout of a similar percentage. And these are very different than the pre-earthquake elections from 1990 up until Préval's election in, after the coup, in around 2007, after the de facto government stepped down. All of those elections had like 50, 60, 70% turnouts. And so we really see a marginalization of a deepening marginalization of the poor, and a political disenfranchisement, and that really then boiled to the surface and over recent months in late 2018 and early 2018.
You write about a spate of kidnappings that has swept Haiti recently, even involving the capture of medical professionals. Explain for viewers what is going on there.
So, these are societies that have been like systematically wrecked. And so basically as that happens over time, people are really like, I write in the article, they're condemned to rampant crime, unemployment, inflation, alongside disintegrating infrastructure and government services. You have 40% unemployment. There have been paramilitary groups that have been inserted into the police. Right now, there's something like 17 different police, like special groups that have been organized, all with very high-tech, advanced weaponry.
And the military.
Yeah, and the OAS has actually a defense board within the OAS has worked with the Haitian government to recreate the Haitian military that was disbanded in the late 90s because it was such a brutal military involved in so many coups, massacres, campaigns of repression. And so in that context, you see, of course, you're going to see a lot of confused social melees where poor people are, harming other working class people, and back and forth. And so in that situation, you see, criminal syndicates and groups. And on this one occasion, or on a number of occasions over recent weeks and months, the last few months, there's been some kidnappings where, they try to get high-value targets. And so there was this guy, Dr. Jerry Bitar, who co-runs one of the best hospitals in Port-au-Prince. And so all the doctors and nurses went on strike. And then the kidnappers released, thank God, they released the doctor after that. But it's just a very difficult situation for people.
It's difficult also because, as you say, as wealthy countries, as the colonial countries, which are used to exploiting the underdeveloped nations such as Haiti, are on their own struggling to respond and take care of their domestic populations. We're not going to see the same kind of response to provide international aid to countries such as Haiti, when it's already been so difficult to get aid into Haiti. Whenever there's a crisis, I remember, for example, the earthquake in 2010, all of the mainstream networks were telling people in the US to text the Red Cross and donate to the Red Cross. And then later we found out that the Red Cross, with all that money, only constructed a couple dozen homes, I think, even if that. So why might Haitians be skeptical of aid from international organizations such as the Red Cross, like the United Nations even? And what are people to do if they want to aid Haiti? It sounds like if anyone is helping Haiti right now, Cuba certainly is. Are there any other avenues people have through which they can assist?
It's a really tough situation, Anya, because if you exist on a few, like say you exist on $2 a day, there's a good chunk of the population that does that, or they can on occasion find some informal employment. If you exist in that situation, then any aid you can get, any option available. So like the Inter-American Development Bank, I guess, is committing $50 million. There's a UN $2 billion plan, but that's divided amongst like 50 countries. With the earthquake, there was this massive amount of, money that flooded into the country, and all sorts of corruption schemes and, different elites in the country trying to latch on to these supranational institutions and transnational companies. And so it's just a very complicated situation. I mean, if you say you might not be, someone who's evangelical, even though there actually has been a massive growth of people of evangelical faith in Haiti over recent decades. But even if you're not, if you live in a community that has a church that is being funded from, say a congregation, maybe a conservative Republican congregation in Mississippi, let's just say, if they exist, if that church is in your community and they're providing medical aid or some support, it's just like the structural situation that you live in. There's no other options. So it's very tough for people. And I think, we have to understand this and its history, how all this has come about, and why is Cuba the only country that is sending all these hundreds of doctors to so many countries. It's not just Haiti, too. They've been sending them to, I think, Grenada, to Suriname, to Venezuela, to Nicaragua, to a lot of countries in the region.
And beyond.
Yeah, why is the United States the wealthiest country in the history of our species, the most powerful empire what Homo sapiens have been here for 150,000 years. The United States is the most powerful empire ever, right? With almost 1,000 bases around the world, and we can't send brigades of doctors to these countries that we basically, have a commanding influence on.
And we can't even care for our own population. Our healthcare system is completely not even underprepared. It's not designed to respond to a crisis like this or take care of people. And we're seeing organizations like Samaritan's Purse, you're talking about evangelical groups, even building hospitals, makeshift hospitals in New York, let alone Italy or Haiti. So this is the reality we're faced with.
Yeah.
It's troubling, that's for sure. But I appreciate you coming on Red Lines today, Jeb Sprague, to discuss this story and also for your reporting at the Grayzone and beyond in general. We will follow your work and stay in touch as all of this continues to develop. Thank you so much, Jeb.
Great. Thanks, Anya. I appreciate it.